Yeah, okay.
Okay, Donald,
Hi, morning.
you hear us?
Yeah, I can hear you.
Good, good. So you will be the second to speak.
Okay.
即係每個禮拜六嚇，要 spend 2個鐘頭。
哦，就唔係每個禮拜六，唔係個個禮拜六。
有大扎啦，你一路去到3月都
係，呢個完咗就去到明年初㗎啦，係有12月冇嚇。
OK。
我依兩多呢啲咁嘅，即係透過 Zoom 嘅 meeting。尋日喺嶺南有個係講 high education development after COVID-19。
係。
咁啊，張真都有參加，你仲搞咗個平台講 education。
Shall we start?
Sure.
Okay, good morning, everyone. Welcome to this, policy dialogue series, which features Professor Anthony Cheung, and my name is Alex He. I'm the currently associate head of the Department of Asian Policy Studies at the EdUHK. So we have been co-hosting this highly successful event with the Division of Public Policy at HKUST for almost 2 years. And today we have the high pleasure of inviting Professor Anthony Cheung as usual, and then Professor Christine Low and Professor Donald Low here to join us in this policy dialogue. So the topic today is the impact of COVID-19 pandemic, crisis management, governance, and policy priorities. So as everyone knows, this current pandemic is transforming, our lives in every way, and it's rewriting human history. And 2020 has been so long and so challenging. And here in Hong Kong, we are probably, welcoming the fourth wave of local outbreak. So everyone is worried. So, and then today we have this great opportunity of bringing together 3 highly distinguished speakers to this panel discussion. So let me very, very briefly, actually none of them needs any introduction, but as formality, let me very briefly introduce them, one by one to you. So Professor Anthony Cheung was the former Secretary of Housing and Transport of the Hong Kong SAR government from 2012 to 2017, and he was also the former president of Hong Kong Institute of Education, and he's currently the research chair professor of public administration at EdUHK. And Professor Christine Low was the undersecretary of the environment of the Hong Kong SAR government before, and she's currently also a advisor of the HKUST. And she specializes in environmental policy and so on and so forth. And Professor Donald Low is currently a senior lecturer and professor of practice at the Institute of Public Policy at HKUST. And he has very rich experience in policy consultancy, advising, and so on and so forth. So today, the format of the dialogue will be, so 3 speakers will make their presentations one by one, Professor Anthony Cheung and Professor Donald Low, and then Professor Christine Low. And then we will, as moderator, I'll be throwing out some questions to facilitate discussion. And then in the end, we'll leave some time for Q&A. So without further ado, now let me invite Professor Anthony Cheung to kick off.
Thank you, Alex, for the very kind introduction. The topic of today is the impact of COVID-19 pandemic. I remember in last year's series, back in March this year, we had discussed COVID-19 for the first time. And I remember it was me together with Professor Donald Low. At that time, I think we did not anticipate that this pandemic could last that long, because even now, we have no idea as to when the pandemic would actually subside. Most would expect the pandemic to last until the middle or even later part of next year. So the impact could be quite significant. And right now, as we gauge the impact, I think it would be fair to say that this is the impact that we're able to see so far. We haven't yet seen the worst, perhaps, of the pandemic, because right now in Europe, they are experiencing the what they would describe as the second wave of COVID-19, which is quite serious in some countries in Europe. Okay, I have a slide, a PowerPoint, so let me share this with you. Oh, so, okay, right. I would like to look at the impact from the perspective of crisis management. And here on this slide, I will use the alphabet C to highlight the key points about the various aspects of the politics of crisis management. Because ultimately, a pandemic as a crisis is not just about public health. It affects the economy, public confidence, and of course, ultimately, the performance of government. And therefore, it has to be looked at as also a governance crisis. Now, there are various observations about the politics of crisis management and different perspectives in assessing the impact of a crisis on politics, on governance. Now, crisis prevention, which is often talked about, is not the same as crisis management. Because in crisis management, we are not talking about how to prevent a crisis, because the crisis has already happened. And therefore, how to deal with the crisis, how to sort of minimize the crisis or the impact of the crisis, that will be the most important. Now, one of the very important elements of crisis management, the first C, is communication. I think we all agree that it's important for the community to know what is really happening, how government will communicate to the community. However, in any crisis, because of anxiety, panic, and so on, oftentimes we find that there is a lot of information and misinformation, overloading by information, and information becoming too excessive sometimes, and therefore it's difficult for the public to really understand what is happening, what is the likely consequence of the crisis. So from the crisis management point of view, particularly from the government's point of view, it is important to manage communication. And here I would highlight the second C, which is crisis narrative. And the narrative has to be focused and also to really demonstrate the capacity of the government to lead people in the crisis. The third C is confidence, because the community might question if the government is able to handle the crisis and to minimize the adverse consequences of the crisis. So therefore, how do you restore confidence in crisis management is very important. And it depends a lot on the capacity of the government to deal with the crisis and the credibility of the government. Now, in a society where there is high level of trust in the government, maybe it's easier, despite panic. But if there is a lack of trust, lack of confidence in the government, perhaps it's more difficult to handle the crisis. And bear in mind too, that in any crisis situation, rumors will arise, and rumors will spread very quickly. The next C has to do with the views among experts as well as various sectors in society. And there are unavoidably conflicting views. And if there are conflicting views, even among scientists, experts, how do you arrive at the right decision, the right balance, given various views, various suggestions as to how to deal with the crisis? The fifth or the fifth C has to do with the nature of a crisis. Like a virus, a crisis can mutate. A small incident could eventually mutate into a major crisis. And here I use the story of Mrs. O'Leary's cow as illustration. It's alleged or suggested that the Great Chicago Fire of 1871 resulted almost by accident because of Mrs. O'Leary's cow running amok in a shed of behind her house, and eventually her house was in fire, and gradually and ultimately Chicago was in fire. So it describes the unanticipated sort of mutation of simply an isolated incident. So ultimately, we are talking about the uncertainty of a crisis, the panic that may accompany a crisis, and how do you achieve confidence despite the disruption. And if you have a major confidence crisis, that may lead to economic crisis and ultimately governance crisis. And if politics get into the crisis, then you have all kinds of blame and shame politics emerging. Now, after a crisis is over, oftentimes, of course, we try to learn lessons from the crisis, as what we are doing today. But it all depends on whether lesson learning can lead to post-crisis systemic reform, and whether that kind of reform is sustainable, so that next time, if a similar incident happens, maybe people have become wiser and less narrow-minded. But of course, no crisis is exactly the same. History doesn't replicate itself too rigidly. So therefore, we have to be on the alert. We have to appreciate that the crisis could mutate, an incident can mutate. Now, that's the general framework which I will use to assess a major crisis like COVID-19. Now, let's look at some background information regarding COVID-19, particularly COVID-19 in Hong Kong. Now, the broad picture first, the world picture, you'll see that the number of cases has already exceeded 52 million worldwide. And number of deaths, almost 1.25 million. And these figures are really very significant in terms of the impact of COVID-19. And the map here, which I have borrowed from New York Times. Now, you'll see that the red part represents where COVID-19 seems to be most serious. And the lighter the color is, the less serious. So you see in North America, particularly in the US, and then in certain parts of South America, and then Russia and Europe, they are in a way hardest hit in the current, based on the current situation. Now in Hong Kong, government has taken quite a lot of steps since the virus was sort of recognized back in January this year. At that time, it was listed in the list as one of those notifiable diseases, even though the name COVID-19 was yet to be given by WHO. Now, I will not go into the detail of those measures because many of us here, we are from Hong Kong, we know what has been happening. And in a way, it would be fair to say that the government has rolled out the usual list of measures. We have learned from SARS, from the swine flu in 2009 rather. So therefore, we know what to do. There is a kind of SOP, standard operating procedure. So port health measures, outbound traffic alerts, immigration control, enhancing quarantine facilities and services. And I think Hong Kong, among the East Asian jurisdictions, is noted for putting a lot of emphasis on tracking and testing. And recently, we even have a non-compulsory universal testing scheme. So in other East Asian countries like Korea, like Singapore, China, of course, we all put a lot of emphasis on tracking, tracing, testing, make sure that the virus is under control. So it's a kind of suppression strategy. Social distancing was emphasized quite early on, including the closure of schools, university campuses, and stopping people from group aggregation, restrictions on catering and food and drink premises. But of course, these measures did cause some controversy, some public discontent, particularly at the beginning. Enforcement and coordination, in my view, have become better managed compared to SARS. And the government has also launched an anti-epidemic fund. And there have been 3 rounds of allocations from this fund, and also special budget measures in the 2020-21 budget. Altogether, government has allocated a total of 311 billion Hong Kong dollars. And that's roughly 10 to 11% of Hong Kong's GDP, which is quite significant. And thanks to our fiscal reserve, I think we are still able to spend some money on this. But in some other countries, actually, their governments have got into national debt in order to provide stimulus packages. We have the usual risk communication and daily briefings. And I think by now, Dr. Cheung from the CHP, the Center for Health Protection, has become almost an icon of the city. So I think we have done all the right things. And thanks to some of these measures, I think we have, in a way, kept COVID-19 under control, if you look at the figures. These slides are just to give us, to refresh ourselves of the various measures. Now, these pictures, they are taken from the government's Facebook, the Tema Talk Facebook. For the anti-epidemic fund, this slide just indicates the scope of the fund, what kind of activities or schemes have been covered by the fund. I mean, basically to keep jobs, to support some industrial sectors, business sectors, particularly the small and medium enterprises, to make sure that those sectors and individuals who are directly affected by government's anti-epidemic measures, they are suitably given relief measures. Now, I won't go into the detail because some of those measures, people might argue whether they are rightly sort of targeted, whether money is well spent or spent on the most needy aspects. And that could be a matter of debate. But of course, we can also at the same time see that like other countries, like other economies, Hong Kong has not forgotten the importance of the business or economic aspects of a crisis management process. Now, we have gone through, up to now, 3 waves of COVID-19. And the experts like Dr. Yong, they are warning that we might face a 4th wave because of the weather getting colder and so on. And this diagram just gives us a sense of the 2nd and 3rd waves. The 2nd wave occurring around April this year, and most people would suggest that that's because of a large number of people returning from overseas to Hong Kong as COVID-19 spread very quickly in the US, in North America, and in Europe and also Australia and New Zealand. And then the third wave began around July, and some would suggest that that is because back in June, government, sort of the community at large thought that COVID-19 was already well under control, and some restrictions were relaxed, and therefore suddenly people came out very actively, and then you have so-called the factor of exempted persons, those who were not subject to control. Now, let's look at some figures. Now, this is the figure, the figures in June this year. That's before the outbreak of the third wave. And you can see that Hong Kong was doing very well, if you look at the figures. 149 cases per 1 million population, 0.5 deaths per 1 million population. And Hong Kong was doing even better than Singapore, than South Korea, than New Zealand. But after the third wave, the situation has changed slightly. Now, this is the latest figure, as at yesterday. Now, figures based on Worldometer's website. Of course, different media outlets may capture the figures slightly differently. Now, by yesterday, total number of cases per 1 million population is 719, and number of deaths 14. So we have done less in relative terms compared to June this year. Probably we are on a par with Japan or South Korea slightly. South Korea is slightly better than Hong Kong based on these figures. And so far, Taiwan, Macau, the mainland of China are doing very well. And New Zealand is also very outstanding. The worst will be the USA, followed by Spain, based on these figures. Now, by and large, Hong Kong has got it right because we have learned from the past experience in SARS and the swine flu. We have an early alert. We have speedy response, readiness, and surge capacity. Of course, surge capacity is still subject to limitation. We'll come back to this later on. Expert advice, professionalism of our medical and caregiving personnel, vigilance, the approach taken in terms of containment, suppression, coordination of various sectors. And government this time, I think, has done better in terms of coordination compared to the time of SARS 17 years ago. The community has also become more risk aware. That's why from very early on, people were trying to get face masks. And there was panic, anxiety, panic shopping. Initially, Hong Kong was laughed at because of panic shopping, but we find that eventually all other cities have gone into panic shopping once they realize that they are affected by COVID-19. Pandemic information, health advice, they are sufficient. But of course, later on, I will talk about the deficiency in crisis narrative. We are on the right track, but we can raise some questions. Right track in terms of the suppression strategy adopted, testing, tracking, social distancing, but we may ask, can we do better in terms of suppression strategy? Can we focus more on the so-called vulnerable sectors? Maybe for those sectors, we may do more testing or even compulsory testing. Secondly, could testing be conducted in a wider manner or even compulsory manner in order to be more effective in terms of suppression? But of course, there are different views in the community. as to whether testing should be compulsory or not. In terms of support relief packages, I think we have rolled out a lot of measures which are not mean at all. But then the question could be asked, are we spending our money in the best manner? In other words, are the measures sufficiently well targeted? That again could be an area for reflection, for review. And finally, in terms of addressing the economic shock, in terms of stimulus package, now we have to realize that we have to address both the supply and demand shocks in the current economic recession. We have to keep companies active. We have to keep jobs. But sometimes keeping companies doesn't necessarily mean that we are keeping jobs as well. It depends on how firms and companies react. And keeping companies and jobs doesn't necessarily mean you're able to keep consumption and economic circulation, because you have to allow people to spend money to consume. Too much social restrictions may perhaps hinder that kind of effort. So how do you draw the balance in terms of achieving the maximum impact in a stimulus strategy? I think that is an area that we could debate on. So very briefly, the lessons so far. At the beginning, the government perhaps was not fully prepared for public reaction and even panic, and the shortage of some strategic supplies, including masks, PPE, personal protection equipment, panic shopping. But gradually, we have overcome that kind of shortage. There was a bit of debate, dissatisfaction, discontent over containment and closure measures. And but by and large, by now, we have overcome that. Expert advice has always been there, but of course, experts do not fully agree on everything. And I would say that the WHO advice was too conservative at the beginning, underestimated the impact of COVID-19. And at the same time, we have to recognize that in any crisis situation, the government cannot just listen to the experts, because they are non-expert views. They are diverse views within the community, and in the political reality of things, government has to strike a good balance among these different views and demands. For the hospital authority, our public hospital system has got better prepared this time compared to SARS, but still there has been suggestion that PPE and hardware are inadequate, and public-private collaboration capacity could be made better. The speed of response could be made better. Now, this is not my position, but these are views expressed by the Hospital Authority Chairman, Mr. Henry Fan. He was interviewed by Ming Pao back in September this year. In terms of government's decision-making, I think this is the most challenging part, whether for the government in Hong Kong or elsewhere. It's a matter of balancing and trade-off among different factors. Balancing and trading off between risk assessment, different expert advice, practicalities of various measures, public reaction, the wisdom of the community, social and economic impact, and whether some measures, though they seem to be good, but whether they are fully enforceable. All these things have to be balanced. So we should not imagine that it is a simple task. But of course, whether or not government has been able to sort of bring the community through this very challenging process is very important. But Hong Kong is not alone in facing controversies in any crisis situation. We have seen that in the US, in the UK, and almost every other country. So the question really is, could government communicate well? And in Hong Kong's case so far, could government have communicate better. In terms of communication, I think it's not just about giving a lot of data, giving a lot of information. It's not the volume of information which is the most decisive. It's rather whether the information can result in clear messaging on what to do. Because in any crisis situation, when people are in panic, they will expect government to advise them, to give them guidance, what to do. If I don't have masks, what is the alternative? If the system doesn't have enough PPE, what is the alternative? Now, these advice on what to do, the clear messaging, focusing on the anxieties, is more important than just giving a lot of information and let the public pick and choose. And next important thing is to bring the community on site, because obviously you face dilemmas, you face very difficult decisions, restrictions regarding social distancing, for example, and you have to take the public through the difficult process of crisis decision making, make them realize that we have to balance different imperatives and objectives, demands, and this includes the aspect of border closure, because at the beginning, some people demanded that we should close our border entirely. So we have to fully explain the issue. What is meant by border closure? Do we allow Hong Kongers to come back to Hong Kong? Is that part of border closure? And in fact, no country in the world has actually imposed total closure. You can argue that it's partial closure, but some have closed down more extensively than others. It depends on the pandemic situation. And crisis management in a pandemic is always paradoxical and facing dilemmas or even trilemma situation is public health, come social, come economic, and come politics situation. And that's why government leadership is so important. But unfortunately, in the case of Hong Kong, over the last year or more than a year, because of the political unrest, unfortunately, government enjoys a very low level of public trust. And that, in my view, has hampered crisis leadership, despite the fact that overall the government or the extended public sector has done rather well in terms of responding to the pandemic. Now, I don't know whether I have enough time, but maybe very quickly, just let you see some figures regarding the global situation. So this is the global situation in terms of COVID-19 cases, and you can see the rising trend is still ongoing. And in the US is the worst country so far in terms of the pandemic situation. Number of deaths, number of cases have been rising, and it's now every day more than 100,000 cases more every day. The situation is also serious in Europe, which is facing the second wave. Right? And based on this, the information up to yesterday, so up to the 5th of November, you can see that the worst hit country in Europe was France, followed by Italy and Spain. And Italy and Spain have always been facing a daunting situation. Now, the economy is also badly affected. Now, just have a sense of the consequences of COVID-19. It was predicted by IMF back in June this year that by the end of the year, world output will be 8% lower. In other words, negative 8% growth. And by the second quarter, 1/6 of young people worldwide have lost their jobs, and it's serious. And low and middle income economies will shrink this year for the first time in at least 60 years because of COVID-19. Some 89 million people will be pushed into extreme poverty, a rise of 15%. And overall, gross public debt to GDP ratio of advanced economies has gone up to an estimated 132% by next year because of different countries having to roll out stimulus strategies. And they have to rely a lot on debt. And lockdowns have affected not just the economy, but also the mental health of people. So most will agree that this is the 2020 Black Swan. You have never expected that to happen. Again, figures on the economy. So we are facing negative growth within the US, OECD countries, or the world at large. Now I will move on faster. Just a couple of slides to show the impact on politics. Very diverse impact. In New Zealand, the Prime Minister got re-elected by landslide because of the effective way she had dealt with the pandemic. What is described as go strong, be kind, or even go very quickly in suppressing the COVID-19. In the US, now this is, I won't say open because it's a four-letter word. That's how Donald Trump described the virus, because his assistant, actually his digital advisor, told him that because of COVID-19, then his chance of getting re-elected will be affected. And indeed, he has lost the election. So what can be learned from this crisis? I think I won't go into more slides, but just a highlight here that there are 5 aspects of lesson drawing. First of all, in terms of policy choice, because ultimately it's about balancing. So how do you make a policy in terms of COVID-19? You want to reassure people, you want to deal with the pandemic, the panic. But at the same time, you want to minimize the impact on the economy, on social activities. And sometimes these are contradictory objectives. So how do you arrive at a proper balancing act? That is the challenge in policy choice. And it's not just a matter of science, because sometimes people's expectations could not be dealt with by science. Right? You want to have the economy booming, at the same time, you need to have social distancing, restrictions on gatherings, on activities, for example. The second point, state and community capacity. Maybe I should show this slide. Yeah, this is a quotation from Francis Fukuyama, who is famous for his end of history thesis back in 1989, 1990. Now, observing the situation in many Western countries compared to East Asia, he wrote that, and I quote, "It is not a matter of regime type. Some democracies have performed well, but others have not. And the same is true for autocracies. The factors responsible for successful pandemic responses have been state capacity, social trust, and leadership. Countries with all three, a competent state apparatus, a government that citizens trust and listen to, and effective leaders have performed impressively, limiting the damage they have suffered," unquote. So the degree of capacity, the extent of trust and leadership are very important. Okay. Okay. Communication, we have mentioned that it is important. Trust, if you have a higher trust society, maybe government is able to able to do more. But if you have a low trust society, there may be more debate, there may be more suspicion, conspiracy theory, and therefore it's more difficult. And finally, leadership in a crisis is very important. So it's more than just a crisis, because crisis mutates. There's no exact science, and if you have a situation where communication has not been sufficiently focused, the messaging is not effective, or government leadership is being challenged, or where the government or decision makers see the crisis quite differently from the eyes of the people, there is a gap, then you have more problems. For example, in the case of Hong Kong, I remember when government first announced that people could not eat in, even during lunchtime. Then you have a lot of workers, office workers, or blue-collar workers, they have to eat on the street. So that creates a very nasty scene, and government was forced to withdraw the measures. But that highlights the importance of how to see the crisis from the eyes of the ordinary people who are affected and who have to react based on whatever restrictions or challenges they are facing. So how do you seek the turning points to minimize loss and maximize opportunities for change? I think that is a very important thing in a crisis. So just to conclude, I'm going to this slide, final slide to conclude. So Hong Kong is at the risk of facing a triple whammy: government weakness because of a lack of trust, the pandemic itself, and later on, or even now, the economic setback that will likely induce more discontent if not handled well. And in the economic aftermath, then you have all kinds of problems emerging, affecting jobs, wage levels, or even the market at large. Some sectors are more affected, suffering more, for example, aviation, hospitality industry. And obviously, there will be demands for assistance. Luckily, at the moment, Hong Kong still has quite a decent level of fiscal reserve, but money is not unlimited. So therefore, how do you make the best use of our reserve for re-stimulation the economy? I think that is crucial. And we have to make sure that the pandemic is under control. Otherwise, government will be blamed for not handling the crisis well. So a crisis can make and break a government. In New Zealand, the government has been very successful to prove that it is very competent in dealing with the crisis. In the case of the US, maybe if there was no COVID-19, Donald Trump has no trouble in getting reelected. Now in Hong Kong, I think we have to beware that the governance crisis may worsen. So it all depends on how we deal with the various aspects of the pandemic on Hong Kong's governance. Thank you very much.
Thank you so much, Professor Cheung, for these wonderful thoughts, and we'll leave the discussion to the end. So now let me invite Professor Donald Low to give his presentation. Donald, please.
Yeah, thanks, Alex. Thanks, Professor Cheung, for the invitation. So I'll share. I'll need the host to unshare the original presentation so that I can share mine.
Stop share. Yeah.
Yeah. Okay. Thanks, everyone. Let me share my. So So Professor Cheung spoke about how, in Hong Kong's context, a government that doesn't enjoy a high degree of public trust, you could even say the Hong Kong government suffers from low public trust, has been quite successful, reasonably successful, by the standards of advanced economies, to contain this pandemic, right? To at least so far, the number of infections as a percentage, as a proportion of the population, has been quite low in Hong Kong. So in many ways, the Singapore experience represents is diametrically opposed to the Hong Kong experience, right? The Singapore government enjoys a high degree of public trust. But at the same time, Singapore has had a much higher level of infections, about 10 times more than Hong Kong. Although I should also add the mortality rate, the number of deaths due to COVID-19 in Singapore is actually lower than Hong Kong's. So it's almost the mirror opposite of Hong Kong, despite the fact that both jurisdictions, both governments went through SARS 17 years ago. I just want to say that it is not unexpected or unpredictable that societies do poorly in a pandemic such as this, right? So this was written by George Soper back in 1919 during the time of the Spanish flu pandemic. And it says, why is it so difficult for not just governments, but societies to grapple with this sort of pandemic? It's first, there's a great deal of complexity and range in the severity of this infection, right? We know, for instance, that among young people, the mortality rates are very low, as low as with the seasonal flu. But with older people, especially people in their 70s, 80s, and above, this is as deadly or more deadly than SARS, right? So that makes it difficult. This complexity, this range of uncertainty makes it difficult for people to wrap their heads around this pandemic. Second, very fundamentally, the burden of dealing with this infectious disease lies with individuals, right? In terms of the personal hygiene, in terms of mask wearing, in terms of not going out as much, right? And the burden is placed on individuals where it is least likely to be well carried out. So this is very different from efforts to say eradicate malaria or other kinds of public health challenges where you need a big competent state to deal with it, right? Here, the burden is highly individualized, right? Individuals have to make behavioral changes, and that makes it difficult. Third, the highly infectious nature of this virus means that it is transmissible even before the patient knows he himself is attacked, right? So this is the thing about asymptomatic transmission. It's very hard to tell individuals you have to stay home, you have to isolate yourself for 2 weeks, 3 weeks, when the individual does not even feel unwell, right? Much less, right, telling him you shouldn't go out, you should wear a mask, just asking him to stay at home is difficult because he doesn't feel unwell, right? So I think we should remember this in the context of how difficult it is for individuals, how challenging, how cognitively demanding it is for people to make behavioral change in the face of this kind of crisis. So this is the Singapore experience. So it's a bit of a paradox, right? First, you've got very high levels of infection. And second, you've got very low levels of death, right? If you look at the mortality rate in Singapore is, in fact, actually lower than the seasonal flu. Seasonal flu is about 0.1%. In Singapore, the mortality rate of this COVID-19 is actually 0.05. So it's a bit of a paradox. So has the Singapore's experience in COVID-19 been a success or a failure? It's actually asking you the question, is it half full? Is the glass half full or half empty? I think my own response to the question is, right, has it been successful or a failure? I say it depends on what your original objective was. If your original objective was containment, minimizing the number of infections, then you could argue that the Singapore government has failed. This is a very high level as a percentage of the population, a very high level of infections. If that was your objective. If your policy objective was to keep the number of deaths low, right? Never mind that there are lots of infections. That one can't be, you may not be able to do much about, but keep the number of deaths low. Then in that respect, the Singapore government has been, or the Singapore experience here has been a great success, right? It is one of the lowest mortality rates. So the answer to the question is, it depends, right? It depends on what your original policy intent, your policy objective was, right? And talking about that, right, Professor Cheung spoke about what lessons did governments draw from SARS and subsequent epidemics. I think the SARS and the subsequent epidemics gave governments two sets of protocols or two sets of playbooks, right? Two sets of SOPs. The first is an SOP around containment, right? We learned that from SARS, which was a lethal but much less transmissible disease. So what does containment consist of? Testing, contact tracing, quarantine, isolation. This was something Singapore did very well in the first 2 or 3 months of the crisis. In fact, the Harvard Medical School called the Harvard School of Public Health called Singapore's containment efforts its testing and contact tracing efforts gold standard, right? And in that period, the numbers of infection in Singapore was very low. A second playbook, a second set of SOP or protocols has to do with mitigation, right? This is where you recognize that the disease is already circulating widely in the community. The window for containment has passed, right? You can't put the genie back into the bottle, right? This is something that is already in the community. The best you can do now is do everything you can to minimize deaths, right? So this is something that we learned, or the protocol was developed after H1N1, right, in 2009, right? In the case of, and so, you know, Professor Cheung talked about how, you know, every time we face a new crisis, we are always looking back to the lessons we drew from previous crises. In the literature, we call this path dependence, right? This is an example of path dependence. And that is absolutely the case in Singapore, right? When the crisis first started, when the pandemic arrived, or the epidemic initially arrived, immediately we take reference from, is this more like SARS or is this more like H1N1? And what was so complex about COVID-19 is that it is actually more transmissible than H1N1 because we have zero immunity to it. At least with H1N1, certain people, especially older generations, had immunity to H1N1. So with this, we have zero immunity with it. So it's going to be highly transmissible. Which means that might suggest that maybe you should just deal with it as you deal with flu, as you deal with mitigation. You deal with it through mitigation, since it's highly transmissible. But the problem is, it is, even though it's not as deadly as SARS, the fact that it's going to infect so many people, the fact that it is so contagious, means that your hospital system might be overwhelmed if you resort to mitigation measures, right? So that means you really have to combine both containment and mitigation. And in many jurisdictions, the answer, you know, with that was to throw the kitchen sink at the problem, which is, right, suppression, right? Do everything we can to suppress the disease, so that because it's so contagious, if you don't suppress it, it's going to overwhelm the health system. And even if you wanted to do mitigation, you can't do mitigation when your health system is overwhelmed. You're going to get many deaths, right, when your health system has collapsed. And so I think that was the challenge of this particular pandemic. It's such a wicked problem because you cannot easily deal with it based on the protocols or the processes or the lessons you drew from that we drew from previous epidemics. So in the case of Singapore, initially when we were the gold standard of the world in terms of contact tracing and containment measures, most of the cases were imported in the early stage, like up till March, when there were Singaporeans returning from abroad. You know, most of the cases were imported. And also now, when the virus has finally been suppressed, the few cases we have every day are imported ones. The second wave in Singapore, you could say, came from our large community of migrant workers. In Singapore, there are about 1 million low-wage migrant workers from South Asia, from China, from the rest of Southeast Asia as well. And many of them live in dormitories. So the large outbreak, more than 95% of the infection numbers have come from these foreign workers living in purpose-built dormitories, which are very cramped living conditions. And certainly that was the crisis that Singapore was having to deal with from around mid-April onwards, all the way to June, right? When Singapore had a 60-day, what we call a circuit breaker, is almost like a lockdown, right? You know, there was one day I remember in the end of May, towards the end of May, when the daily case in Singapore, more than 1,000, was more than the entire caseload in Hong Kong at that point. Right? At that point, Hong Kong had about just under 1,000 cases, and Singapore had 1,000 cases new cases in one day. So the paradox or the question that I've been asked a lot is, why didn't Singapore handle this well? Now, first bear in mind that I don't think Singapore didn't handle this well. As I said, it depends on the question you're asking. It depends on what was the policy objective. I agree with you that Singapore didn't handle this well if your goal, if the policy intent was to minimize number of infections. But be that as it may, so let me say why Singapore should have handled should have responded well to COVID-19. In the literature, and just now Professor Cheung referred to state capacity, right, that quote by Francis Fukuyama. Indeed, you would expect the Singapore government to have responded very well to COVID-19 because of high levels of state capacity, right? In the literature, we call it policy capacity. It has high levels of analytical capacity, right? It does, disaster planning, it does scenario planning. Pandemics is something that has been flagged before many times in scenario planning exercises. There is a Center for Strategic Futures. If you look at the S, it looks like a black swan. That is deliberate, right? It is meant to. Sorry, can you all see the slides? You all can see the slides, right? Alex, yeah, you all can see the slides, right? Okay, so Singapore's analytical capacity is legendary, right? Supposed to be able to anticipate and analyze and come up with the right policy responses to crises like COVID-19, right? In many ways, a pandemic of this sort is not really a black swan, right? It's something that we have had before to probably to a lesser extent, but the idea that we would face a greater frequency of pandemics, that's not a new idea, right? Second, Singapore has high degree of operational capacity. When the government decides to do something, it can roll it out with great precision, with great attention to detail, and with great operational effectiveness. So at the early stages, for instance, there was a lot of global interest in how Singapore does contact tracing. It's a very manual process initially, and then when the numbers are small, doing it through this sort of highly manual, labor-intensive process is doable. But when the numbers gets to the tens of thousands, you can't, right? And you need a technological solution. And this is what Singapore has done: is rolled out this quite effective contact tracing tool that you can upload on your phone. The government is also now distributing these wearable devices that would allow people to know whom they've been in touch with and whether somebody who they've been in touch with, in close contact with, has gotten the disease. But unfortunately, for this to work well, you need 60-70% of people using this app, right? And unfortunately, that take-up rate has not been that high. So the Singapore government is thinking of ways now of making it not necessarily mandatory, but making it, increasing the take-up, making it more likely for you to have this. So for instance, in this Hong Kong-Singapore air travel bubble, people in Hong Kong who are visiting Singapore, they have to download and operate this app when they're in Singapore, throughout the days when they're in Singapore. Singapore also has national service. Men do 2 years of national service. So at any point in time, Singapore has, right, disposable young fit men, right, whom they can mobilize to, whether it's pack masks or distribute essentials, whatever. 40,000 of them, right, at any point in time. And finally, we have a national stockpile of essentials because, we realize how vulnerable we are in the event of, because we depend on imports for virtually everything, for food, for virtually everything. So there's a national stockpile. So that means, operationally, Singapore is well equipped to deal with something like that. There really should be no reason for anybody to panic or to doubt government's ability to deal with a crisis like that. This gives you an indication of Singapore's high degree of, the Singapore government's high degree of operational capacity. When we discovered that there's going to be a big outbreak in our foreign worker dormitories, almost in a matter of 3 weeks, we were able to convert, the Singapore government was able to convert a large exhibition hall in the east of Singapore into quarantine facilities, non-medical, but if foreign workers, most of whom are young, have this virus and they don't display serious symptoms, they will be quarantined here, right? We were able to put this up in a matter of weeks. Finally, in the policy capacity framework, the third capacity is political, right? Professor Cheung spoke about trust. I think it's important to distinguish between two types of trust. One is what we call generalized trust or horizontal trust. That is trust between the people in the country, right? The citizens usually. But in Singapore's case, it also means trust between residents or citizens and migrant workers. When it comes to generalized trust or social trust, Singapore is not that high, right? There isn't as much social trust in Singapore as there is trust in government. So the second dimension of trust is trust in government. Singaporeans trust government a lot. So when in the early, for instance, in the early stages of the crisis, when the WHO says mask wearing is not necessary unless you are feeling unwell, and the Singapore government said that, nobody in Singapore wore a mask, right? When I left Singapore in end of January, I felt, that people were giving me strange looks when I put on the mask. And when I came back to Hong Kong, I realized 99% of Hong Kongers were wearing a mask, right, at a very early stage of the epidemic. So in that sense, Singapore is almost like the opposite of Hong Kong again, right? In Hong Kong, there's low levels of political trust in government, but among society, among Hong Kongers, I think there is a much higher sense of trust, right? They trust each other to look out for one another's problems. Singapore is almost the opposite, right? They look to government to set directions, to tell them what to do. So there's high level of trust in government, but when government gets it wrong, well, you're in a bit of a lurch, right? Because there's very little trust within society. But like Hong Kong, Singapore has very strong fiscal reserves. Compared to Hong Kong and compared to the Hong Kong government, politicians in particular, Singapore's crisis communications, I would argue, by the government, was superior, right? It really tried to balance between giving people assurance and telling people you have nothing to worry about, but also communicating to them the urgency of the situation and what to expect and what to do in a crisis like that. So as I said earlier, right, reflecting the high trust in government, the high political capacity, Singapore is gold standard in case detection. Let's see if I have time to show you a bit of this video. I don't have time to show you this video, but maybe if we have time later, I can show you. It shows this is the Prime Minister at a very early stage in the crisis, I think 3 weeks into the crisis, talking about, telling Singaporeans what to expect, why there is no need to worry or to worry excessively. We've been through SARS, giving people facts about what this virus or what this disease is like, right? He said it's far more transmissible than SARS, but much less deadly, much less lethal. This is, if you watch this video, you agree with me, I think, that this is crisis communications of a very high standard, right? And it helped to reassure people without causing them to become complacent or overly optimistic. I really encourage you all to watch this. But at the same time, I think in this video, the Prime Minister was a bit too optimistic about, things like, he didn't say anything about asymptomatic transmission. He didn't say anything about mask wearing. And I think in this respect, and he didn't say anything very importantly about the risk of high levels of infection in our migrant worker community, right? He was, I think almost everybody was just worrying about the local community, citizens and permanent residents. So I think, in my view, the Singapore government made 3 analytical errors. Now, when I say that these were errors, I don't mean to attribute blame or to say that they messed it up. These are, in a sense, quite understandable errors if you allow me to explain. The first, if you watch the video by the Prime Minister, I think the government underestimated the severity of COVID-19 and the risk of asymptomatic transmission. Right? In the video, the Prime Minister says, in terms of severity, in terms of mortality, this is more like seasonal flu or H1N1 than SARS. That is correct. But in terms of transmissibility, right, it's going to infect a lot more people. And if you treat it like H1N1 or seasonal flu, you are probably underestimating this disease. Second, as I said, the government underestimated the high risk of asymptomatic transmission. Now, there's a bit of a paradox here. If you thought this was like seasonal flu and H1N1, then you should assume that there is going to be asymptomatic transmission, right? Because with H1N1, with seasonal flu, you do get asymptomatic transmission. So when it comes to this thing about asymptomatic transmission, the government was, I think, overly optimistic that when it comes to this, it is more like SARS, right? It's not that transmissible. And I think that was a serious, with the benefit of hindsight, I think that was a serious analytical error, right? I think we got lucky with SARS, that in the case of SARS was containable because patients were infectious, were contagious only if they had symptoms, after they had symptoms, right? With this, this is much more like the cold, right? Where even if you don't have symptoms, you may spread it. And this thing, the ignoring this risk or underestimating this risk of asymptomatic transmission informed the initial policy of discouraging people from wearing masks unless they were feeling unwell. And third, as I said earlier, the government underestimated the possibility, in fact, the high probability of a large outbreak in migrant worker dormitories. So at a very early stage in April, I say, what lessons can we draw? Can the Singapore government draw? The first, I think, is it is not good enough to count on high trust in government and to count on government to make all the right decisions, all the right calls. You also need a strong community response. And I think that's where Hong Kong offered some lesson, right? The community response from Hong Kong in the early stages, I would argue, was actually much stronger than the governmental response, and certainly far superior to the community response in Singapore. I mean, there was very little of a community response in Singapore in the early stages, right? We just looked to government, we trusted government to be able to solve this crisis. As I said at a very early stage, I don't think I have no doubt Singapore will survive this crisis. The number of infected cases will eventually reach several thousands. Now it's reached almost 60,000. So I was very prescient. But I also said the mortality rate, at that time, I said the mortality rate should be very low. Right? And again, I was right in that. The mortality rate is well below 0.1%. Right? So what's the lesson? I think the lesson here is we can't just rely on a strong, competent in government. Right? Trust in government, yes, is a valuable resource, but it must be combined with a strong society, right? And between this strong government and a strong society, you have a narrow corridor, right? One that can check and constrain, to some extent, the state's mistakes and the state's errors, and at the same time, allow the state to function, right? And allow the state to protect our rights and freedoms. So this idea of a narrow corridor is the idea that is described very well in this book by Asemoglu and Robinson, right? Where you really, for advanced countries, or advanced governments, you really need both, right? You need a strong state and a strong society. And within this state, you have what they call a shackled Leviathan, a shackled government, right? That is able to increase its capacity, increase its ability to deliver public goods, but at the same time, ensure people's freedoms and liberties. If you have only a strong state, but a weak society, the risk is that of despotism, right? An overbearing and overwhelmingly dominant government that suppresses its people. If you only have a strong society, but a weak state, well, then you have an ineffective state, right? The state is absent, right? You look at places like Lebanon, you look at failed states, right? They may not necessarily be just weak governments. They may have strong societies, right? But those strong societies prevent the state from mobilizing resources, from accumulating power, from acting in the common good. Finally, I'll say something about underlying biases that we have. Why did we miss this? What were the cognitive biases or assumptions we made with our foreign workers? Why did we not see this coming? With hindsight, it should have been obvious that given the living conditions of our foreign workers, this is a disaster waiting to happen. And I think there are 4 or 5 underlying biases that help to explain why we didn't see or why we missed this, what shouldn't be a black swan, right? First, we don't treat migrant workers as part of the community. Second, we think that having a large population, 1 million people of low-cost migrant workers is necessary for, if you want economic growth, you have no choice but to have a large migrant labor force. Third, we think that their living conditions are good enough, right? Because this is the result of a working, functioning, market-based labor market. And also nobody forced these migrant workers to come. So if they're happy to work with those cramped living conditions, well, this is simply the just and efficient outcome of markets, of labor markets, right? And fourth, we think that it is fair and just that they should bear the cost of their own housing, since we gave them the opportunity to work in Singapore. Nobody forced them to come, right? Society shouldn't have to pay for it, right? And my argument is, well, if you think that this is the case, that society shouldn't have to pay for it, then you're going to pay for it in some other place, right? Like in the pandemic, right? Where because your migrant workers have such high levels of infection, Singapore cannot really resume business as usual. It cannot resume a full reopening. And finally, given all these above, there was nothing much. And there's a certain fatalism in Singapore when we discovered that we've got a large outbreak on our hands in the migrant worker dormitories, There was a certain fatalism that, well, we just have to, this is unavoidable. There was nothing anybody could have done about this. So we shouldn't point fingers. We shouldn't blame anybody. We shouldn't, certainly we shouldn't blame the government. I agree we shouldn't blame the government too much, but I think it is very important for policymakers as well as society at large to reflect on these assumptions and to say that, well, some of these are, right, inherently unequal, are inherently unethical, right? So, and in this context, I thought it is so appropriate that the Oscar-winning show for this year is Parasite, right? And I don't know if you have watched Parasite. I'm sorry if you haven't, because I'm going to give you some spoilers. In Parasite, there's this poor Kim family, right? They managed to get by deceit and deception, they managed to get jobs with the wealthy Park family. Now the Kim family, now you would assume that the parasites in this relationship, in this movie, are the poor Kim family, right? But if you pay closer attention, actually that is a far more subtle question, right? So the Kim family is poor, right? They don't own any vehicles. Their environmental footprint is very low. They live in the basement. So in terms of spatial inequality, you know, the Parasite, the movie illustrates that very well. They live in a semi-basement. They eat leftovers. So their environmental footprint is very low. But when there is a flood, they pay a huge price, right? When there is a flood, their house is wiped out. So this is environmental inequality. Right? Meanwhile, for the rich Park family, when there was a rain, right, they use this as an opportunity to celebrate their son's birthday, right? So the moral of the story here is that, you know, we may think we live in very different bubbles, right? We may think that the Park family and the Kim family live in two different worlds, but right, and the movie also illustrates high levels of spatial environmental inequality, but actually their fates are intertwined, right? Their fates are intertwined in they're interdependent, and the tragedy of the movie is indeed in, you know, when we don't pay attention to these environmental, spatial, health inequalities, tragedy ensues, right? So has the Singapore government learned the lessons from COVID-19? Again, my answer will be half yes, right? The Singapore Prime Minister concedes that there were missteps made, right? If with hindsight, we would have done some things differently, right? For instance, I wish we knew there was this thing called asymptomatic transmission. I wish we tested everyone before releasing them from quarantine. We would have recommended that everyone wear face masks sooner than we did, and we should have acted more aggressively and sooner on the migrant worker dormitory. So in some sense, you might think that the lessons have been learned, but I don't think the deeper assumptions underlying our migrant worker policies, I don't think the deeper assumptions have really been challenged, right? And also, right, the Prime Minister says, oh, this is wisdom after the fact. So, you know, it's kind of a cop-out, right? It says, oh, we only knew all this with the benefit of hindsight. When in fact, I don't think it is the case that the situation in the foreign migrant worker dormitories is something you knew only after the fact, right? Only until after this pandemic. I think we should have known, we should have anticipated this, and our failure to do so is a cognitive failure. It's also a political failure. So finally, if you are interested in reading more about my views on the pandemic and what governments need to learn, certainly what the Singapore government needs to learn from that, you can order my latest book, which just came out a month ago, at books.academia.sg. Thanks very much, everyone, and I look forward to hearing from Christina.
Thank you, Donald, and for the great insights. And now we'll move to the third speaker, Professor Christina.
Okay, I think I might need some help with getting the PowerPoint out. I think thank you very much, and thank you, Anthony, for providing upfront an excellent framework for us to look at this crisis. And thank you, Donald, for going through the details of the disease. So what I will do is cover 3 issues here that you can see on the screen. I will try and move as quickly as possible. And on the science, politics, and policy, I just want to go back and look at China first, because this is the epicenter. And I find it in my research, I find it very enlightening to go through the thinking of China's premier doctor and specialist on infectious disease, is Dr. Zhong Nanshan. We know what he did because it's well documented. How did the Chinese government take such a tough decision right at the beginning? And after looking at China, I'm going to look at the US and make a contrast. The reason I want to do this is that I think these two are the outliers. And you could say that jurisdictions in between them kind of took different formulas at different times of the choices that they had to make. So we know that the Chinese government sent Dr. Cheung and a team of experts to the epicenter, to Wuhan. And when he was at Wuhan, he was able to question the officials in Wuhan, and he determined at that stage that it was human-to-human infection. That was the thing, that the question he wanted to find out. The next day, we know he flew to Beijing, and we know that he personally briefed the top leaders in China. And 2 days effectively after that, a decision was taken to have a severe lockdown of the epicenter. And Dr. Cheung is also on record as saying that Xi Jinping, who was obviously there being briefed, decided what the priority was. The priority was the health and safety of the people. Now, I've kind of put up some of the public utterances of Dr. Cheung. And you can actually go online and find both in English and in Chinese many things that he has said. So now that China has been considered very successful in dealing with COVID-19, we can go back and see what actually they did. In the language of Dr. Cheung, he basically, I think, gave the classic methodology of how to deal with infectious diseases. He says that there were two key strategies. One is suppression and one is mitigation. I know that in Anthony's presentation, we use words like containment and so on, and I don't think that matters too much which word he used. But the ones that Dr. Cheung used is suppression and mitigation. Suppression is what he called, the severe lockdown at the epicenter. He used the word mitigation to really cover what we also call containment. And he said these are two different strategies. They're both highly effective, but you have to do them very well, obviously. So the interesting thing about China is by the time, so they locked down, right, on the 23rd in Wuhan and in Hubei, and in the rest of China, essentially, they put in the mitigation strategy, right? So suppression at the epicenter, mitigation in the rest of the country. So by mid-March, China was beginning to be able to start relaxing because, well, they did rather well. Well, at that time, around mid-March again, Europe started to experience very high level of death. Now, again, I'm not going to go into the details, but it's interesting for us to see the trajectory, to look at what has happened in China. So by the time China was already able to contain the virus, things were beginning to take off in Europe. Now, this again is interesting. Now, in the United States, not very much was done. So even in the summer, you could see that President Trump tested positive, and you can see in the blue box above what Time magazine said about the American experience. And essentially what we're talking about is the Americans downplayed the issue. They did too little up front when there was an opportunity to mitigate much stronger. Now, I mean, this is just an interesting chart to show what Anthony has already shown. You can see in the United States the uptake, and even up until today, things are not contained. Well, of course, this is another very interesting moment. So this is on the 25th of October. This is just before the US election. The gentleman here is Mark Meadows, and he's the White House Chief of Staff. And on that day, he said, we're not going to control the pandemic. So what he's really saying is, well, we're not going to do very much. We're going to control the fact that we get vaccines, therapeutics, and other mitigation areas because it is a contagious virus, just like the flu. So you can see that the narrative that the American leadership was taking is quite different from the one in Hong Kong and the one in Singapore. And I think if we were to look at the narrative in a country like New Zealand and also Australia, actually the narrative is quite different. And then on the 7th of November, when Mr. Meadows himself was affected by COVID. Now, this is another extremely interesting point. The gentleman on the left-hand side is Dr. Fauci. Dr. Fauci is the Dr. Cheung of China. He's a well-respected expert in this area. So just before the election on the 3rd of November, President Trump was at a big rally, and statements were made where the news media reported the next day. It's almost like, well, Mr. Trump got reelected, he was going to fire Dr. Fauci. Whereas in the summer of this year, China gave the highest possible national honor to Dr. Cheung and a number of other people who were very important in helping China control COVID-19. Now, is there going to be a new beginning, and what might the new beginning look like? We have the president-elect, Mr. Biden, and as soon as he got elected, he kind of went into action to declare to America that he's already now put together a high-level COVID-19 advisory council, and that he hopes to be able to take aggressive action on the 20th of January when he should officially become president. Now, the next point I want to talk about, which Anthony already has, is about state capacity. So what is a state able to do? And we also heard from Donald that we can look at Singapore, which is also a very capable government. And I think we can actually look at different jurisdictions and do a kind of analysis like Donald did on before the crisis blew up. How do we look at the state capacity of a particular jurisdiction? So we'll just have a quick look at China's. So in very simple terms, the capacity, a state capacity is, can you do multiple things? And you can you do it well and quickly when you have to? Anthony showed the quote from Francis Fukuyama about it's not what system you have. It's really whether you're able to bring it together. On the left-hand side, there was a paper by someone from the World Bank that talked about state capacity. So I think if you were to look for literature on what state capacity means and have examples of it, I think there are quite a number of renditions out there, but it's kind of interesting to look at because it's about the government. So they talk about the culture of the administration, the culture of the bureaucracy itself. And it also says here that politics is very important because it shapes the incentives of the state's personnel, but perhaps more importantly, it coordinates their beliefs and expectations and thereby the performance of the government agency. Well, before I leave this issue of state capacity, I just want to say that real-time science has been, going great guns because this is the first time, the first infectious disease we have where it is now possible for the whole, somehow the whole world is focusing on this because COVID is affecting the whole world. We also see here that Chinese scientists have been working alongside the medical practitioners and the government in doing scientific research as the disease was taking place. And you can see that a large number of papers that have gone to the best journals in the world so far. Up until May, a third of them were from China. Now, again, on state capacity, I just want to show one thing, which is in the United States, you have the federal government and you have the state government. The state government and the federal government ended up fighting for PPE. So again, this got many of the governors of states in the US very, very anxious and frustrated, because when they had to fight for limited supply of vital PPE, well, they found that they were outbidding each other. So a quick summary again on this federal nature. The government in the United States also decided in April that the federal government would only be a backup to the national crisis. So in a way, the states, you are the primary coordinator, you're the primary deliverer, performer of dealing with COVID. Now, just imagine if the government played more than a backup role, a much more active coordination role, which was what I think the state governors wanted the federal government to do, but that didn't happen. Well, one of the things Anthony already talked about is this balancing between the economy, because people don't want to shut everything down, but we have a public health crisis. So this pressure, the political pressure of reopening the economy, even in different areas where there were containment measures, that it perhaps came just far too soon in many places, so you couldn't hold it. I find this very interesting, but this is just before the election again, and in the United States, people were saying that basically the Republican states were more lackadaisical than the Democratic state. So, actually you can go online and see this graph actually moving. Is very interesting over time. Then very quickly, cultural differences. It was only on the 2nd of April that the WHO said wearing masks was important. So this notion at the very beginning of wearing masks, whether it was important or not, I mean, in Hong Kong, I think everybody just put on a mask because we had that experience in SARS. And this is something that I think self-help, right? People believe that we could help ourselves with that. And that has turned out to be probably one of the most important measures Hong Kong has taken. But in other parts of the world, people are not used to doing this. And also when the WHO said this wasn't vital, I think that made it difficult for people to decide whether to wear it or not. And in many countries in the West, it's taking them a long time to think about wearing a mask. So I think this graph is interesting, again, to show, the trajectory of countries starting wearing masks. So again, my last point is about economic growth. And, we're at a time in the world where there's a geopolitical shift between the West and the East. And of course, in the East, the rise of China and its economy is very important, but it's also creating tension between the United States and China. And right now, we know that the economic growth rate of the United States is slowing down. It's in negative territory. But because China took aggressive suppression, they were able to open up earlier. And you're going to find that the Chinese economy this year is going to be in positive territory. And we're not entirely sure what will happen in 2021. So maybe in time, when we look back at history, this might become an inflection point of the relative growth rate. So my final question is whether this might also be a moment to exacerbate the conflict between East and West. So these are just some final observations for your consideration. Thank you very much.
Thank you very much, Professor Low, for this very short but inspiring talk. Now the virtual floor is open, and please feel free to enter your question and comments in the chat box. And we actually have collected one we got a very active participant, Yu Chen, and he or she has entered lots of comments in the chat box already. So basically, the view was that low trust is not necessarily a bad thing. And I think the case was made in Hong Kong. And then exactly because of the low trust resulting from the social unrest last year, and people here, at least some part of the Hong Kong society, doesn't trust the government. So whatever the message government delivers, and people tend to be suspicious. And then that, in his view, somehow encouraged people to mobilize from the grassroots and do some kind of mutual help. So basically, I think this view somehow represents the view of many Hong Kong people that they simply do not want to give a credit to the government for this outstanding performance. So what are your views on this?
Well, maybe I would give a start to this question. I think it's a matter of balancing. You need both trust and distrust in any system. If you have total trust but no distrust, in a way it means there's no check and balance. There's no challenge to whoever is in charge. And that may breed complacence, arrogance, and so on and so forth. But if on the other extreme, you have total or overwhelming level of distrust, then the trust level is so low so that whatever government is doing, but government is still the government, will not get enough support, endorsement from the community. That will make implementation or policy making more challenging, more difficult. It's hard to make a decision, or even if a right decision is made, then because people will suspect what is the hidden agenda behind, so on and so forth. So I think you need both. And in the in this COVID-19 situation, I would suggest that based on our three presentations, we could at least identify the three S's. The first S, science. Science is important, but of course, it's not the only factor. You have other considerations as well, but science is so important. And luckily, in the case of Hong Kong, I think people trust science. The experts' views are by and large followed. So you still got some legitimacy there. The second S is state, the government. And we have at the moment a rather low level of trust in the government, and therefore, even if the government has done things right, it may not get the right credibility being acknowledged, and it's more difficult to drive people into certain course of action. And then the third S is society, and partly because of distrust in government. Therefore, people will sort of self-help, sort of self-arm in a way. And I think Hong Kong is one of the places where wearing masks was done quite early on, unlike Singapore. So I think that helps in a way to deal with COVID-19.
Right. I find that it's very important for us at this stage, if we're going to learn from this exercise together as a community, that we acknowledge what the government did that is correct, and what we were able to do, which is to put on a mask and, public hygiene, as very complementary and very, very important. But I think it would not be good for Hong Kong if we were to ignore what our government is able to do. Now, we might not like the government, and therefore you don't want to give it any brownie points for having gotten anything right. But you do need the government structure there. And I think people do acknowledge that certain people in government have not done a bad job. So, for example, the daily update of what's happening in Hong Kong, people like that because it is factual and so on. I do think here our senior officials in Hong Kong could ensure that their public communication is more effective. And I think that will help them.
Okay, so Donald, what's your Singaporean's view on the Hong Kong people's reluctance of giving government credit?
I'll speak more broadly. I agree with, I like Anthony's framework very much on science, state, and society, right? I think what you've seen in Hong Kong, where the state doesn't enjoy high levels of trust, political leaders were willing to step back and say, well, let's put our scientists at the forefront, right? Most of the daily briefings were done Dr. Cheung. You know, I'm a Facebook fan of Dr. Cheung. There's a Facebook fan page devoted to Dr. Cheung. She's fantastic. And I think it shows a certain degree of self-knowledge, self-awareness that the politicians said, you know, let's put the scientists front and center, because government may lack trust, but society trusts scientists. And if you look at America, the distrust is not just with respect to the state technocracy. The distrust is also with respect to science. Right? Yes, they've got a strong society in some ways, right? Civil society in the US, they're capable of self-mobilization. But there's deep distrust in state and science. And in many ways, you can think of Donald Trump's victory in 2016, as well as the very strong, relatively strong support he got this year, in spite of his screwing up the response to COVID-19, as a kind of popular revolt against technocratic elites, as well as against scientists, right? I mean, Anthony Fauci has got death threats. Can you believe it? A scientist getting death threats? So yeah, I think I like that framework. So in the case of Hong Kong, trust in science, trust in society. Maybe trust in state is lacking, but I agree also with Christine that actually to really be a high-performing system, you also need high state capacity, and we shouldn't be overly cynical, right? We shouldn't be overly skeptical of the value that a strong, capable, competent, professional, technocratic state can offer. I mean, if this is a long-lasting crisis, you need the state to be right, powering on all its engines. You can't just rely on societal mobilization and grassroots movements and civil society. Yes, those are important, but they cannot, at the end of the day, they cannot replace government. And you still need a strong competence. In the case of Singapore, there was trust in science, there was trust in the state and the state capacity, probably too much, as Anthony was suggesting, but a relatively weak society, right? It wasn't mobilizing itself in the face of this crisis.
Yeah, we got two questions in the chat box from John Yaxuan, and the first is to Professor Cheung: how to educate the public, during crisis? What is the proper way?
Well, I think maybe education may not be entirely the right word, because it may give the impression that someone will tell the public what to do, and this is how you should behave. But probably in a crisis situation or pandemic crisis, the public learns as much from the experts they believe in or the government they follow as their own experience. They've gone through previous crises, SARS. That's why people in Hong Kong are so used to wearing masks or washing hands, and also seeing the experience elsewhere. So experience is also very important. I would say that we have to, in a crisis situation, particularly a long-lasting one like COVID-19 today, we have really to bring the public into the process of thinking how to respond. Of course, ultimately, the response strategy has to be determined by the government on behalf of the whole society. But the process itself could not be closed down. It should not be policy-making in the black box. Otherwise, whatever government is telling people to do, people do not know why, and they wonder. And if they don't trust the government, they would challenge that decision. They would point to other ways. Those other ways may not be sometimes fully appropriate. So we need to bring the public into the process to some extent. And also in terms of state capacity, I think based on what Christine and Donald has said, I think it's useful to distinguish between two parts of the state: the bureaucracy or the professionals and the politicians or the political leadership. Now, in the case of Hong Kong, I think we still have a good degree of trust in the bureaucracy, in bureaucratic capacity. I mean, look at what various departments are doing, or Dr. Cheung of the CHP. But in terms of trust in the political leadership, I think that's the weakest link at the moment.
Yeah, actually, this links us to the question raised by Kenny's Leon. And I think Leon was asking Professor Cheung to make a kind of assessment on Carrie Lam administration's performance in leadership. What is your view on that?
I think, of course, we do not know how the chief executive's team has interacted with the bureaucracy, the professionals, the various departments. I think a lot of hard work must have gone into that. But in terms of the public face, I tend to agree with Donald, his earlier point that perhaps Premier Lee Hsien Loong's performance in terms of taking the lead in articulating the narrative, in sort of sharing the concern with the community, probably that kind of approach should have been better received in Hong Kong than what the chief executive have done. But because the chief executive's performance, in a way, simply tells people, okay, this is decided, this is what to do. I think, but it's important in a crisis to bring people into the process.
I found, I listened to Prime Minister Lee's statements, and he's done actually more than one. And I always find that when they make very high-level statements by the Prime Minister in Singapore, that they're very, very well crafted. Obviously, a lot of thought has gone into it to think about how to communicate with Singaporeans in a way that across society, high and low, people would understand. And his speech was not short. But as I said, he had a lot of messages, obviously, that he wanted to give to the people. And I think if we look at the Prime Minister of New Zealand, her speeches were also well crafted. Yeah. So if we were to look at those leaders in the world and how they spoke to their people that were effective, we can learn something. Again, the US is a significant outlier in this because you have a very unique perspective from the leadership at the moment. Now, the question asked is that the Carrie Lam administration, the question to us was not whether Mrs. Carrie Lam was Mrs. Carrie Lam's administration. So if we were to include all the people in it, including the CHP, including the advice from Hong Kong's very broad and deep knowledge from our public health schools on infectious diseases, I think I have to say, I feel quite safe in Hong Kong. And I think this is being shared by the majority of the people here, because we also have eyes to see how this disease is not being so well controlled in jurisdictions that we have always considered must be better than ours, because they're Western sort of very developed societies, but not necessarily so when we have such a crisis. So I think this is a tremendous learning experience for all of us across the world, and we don't need to beat Hong Kong up unnecessarily.
Yeah. When in Singapore, when PM Lee, tries to comfort the citizens, and then she wears, his pink shirt, and then when he has something bad to report, he changes, to the blue shirt. This is my observation, and I agree that all his speeches are very well crafted, and then he delivers that in very confident way in three languages: Malay, Chinese, and English. So why is there not a kind of established, practice in Hong Kong that the CE directly engages the citizens in the TV speeches? Why isn't there such a practice?
Well, I think, no, I'm just speculating in a way. Because by and large in Hong Kong, because we are still under the, very much within the legacy of a bureaucratic type of government. Now, while the bureaucracy is appreciated for its efficiency, professionalism, sort of very hardworking, sort of rules abiding, but at the same time, we are not, as a system, we are not used to communicating with people. And that is something, I think in Singapore, despite people saying, well, Singapore is a liberal democracy, for example, but it is based on parliamentary democracy. So in a way, leaders have to really communicate with people, ordinary people, the voters. So that kind of experience perhaps might have been instrumental in inculcating a kind of style in communication.
Yeah.
We
Can I
actually
say
got
something? I like the point that Anthony made about Singapore being an illiberal democracy. He's absolutely right. Singapore may be illiberal, a very conservative society, but still it is a democracy. So a democracy forces its leaders who have to be elected to have to communicate, right? And given Singapore's young generation today, leaders have to communicate empathetically. They cannot talk down to people. They cannot be condescending. They cannot be patronizing. Hong Kong, I think, has been, just as Singapore has been described as a illiberal democracy, Hong Kong is again the opposite, right? It's been described as a liberal autocracy, right? And so the leaders, political leaders, may not get enough practice having to say, well, in order to win votes, I need to persuade, right? In order to win votes, I need to show that I can empathize with you. I can communicate you in a way that doesn't create resentment and frustration. So I think, my wish is, we of course we would want to enjoy the best of both worlds. So we want to be liberal, open democracies. But if you had to choose, well, having the Singapore system of having to, leaders having to subject themselves to, the pressure of electoral politics is not a bad thing, right?
Yeah, we actually got a question left over for Donald. The downside of high social trust. What is your view on that?
Are there downsides? Yeah, I think if you look at places like with very weak states, failing states, and you have very strong societal norms, traditional norms. Look at India, for instance, right? Not a very capable state, but very strong social norms, right? Certainly very strong social hierarchies, the caste system. Oftentimes it can prevent governments from getting things done, right? People are inherently, as Anthony says, people are inherently distrustful of government, and keeps government constrained. And but that meant, as students in public policy, public management will know, there are some things only governments can do, right? Mobilize national resources, redistribute, deliver public goods, ensure high quality of public services. These things you can't get away from having the state deliver it. In the book I mentioned, Asamoah and John Robinson's The Narrow Corridor, the archetypal example of strong society, weak state they gave was Lebanon. What happened in Lebanon recently? There was this explosion at the port. Why was this highly flammable material, highly explosive material left in the port? Because the government couldn't decide, right? Wasn't allowed to move the material from the port. It was left there, and then when there was a small spark of a fire, it resulted in a huge explosion. So what you get from weak state capacity and a state that is deeply distrusted, right, by the various communities in Lebanon. So in the case of Lebanon, the state is weak by design, right, because of the different communities. They don't trust each other. They don't trust a strong state to be able to dominate them. So it's a system of highly divided government. Well, the consequences of that is, well, you get effectively, essentially, a failed state that is unable to even provide for basic security and much less talk about rights and freedoms of people, right?
Yeah. Can I just add a point here, which I think is very interesting, because you could say the original designers of a particular system, at the moment that they made that design, they wanted, to either concentrate power more or for it to be more diffuse, depending on whether they trust each other and, ideologies that they have. So in the US system, under a federal system, the states are very powerful. So I think the question going forward for the US is, yes, infectious diseases, it is the state have the power to make a lot of decisions. But if there were certain aspects of a particular crisis where you need a national input and national leadership, then the federal government and the state governments have to come to some kind of agreement on this. And in the United States, where the politics is extremely polarized and fractured at the moment, even with the Biden government going forward and wanting to pay more attention to science and collaboration and so on, we'll have to see whether, because of the federal state division in power sharing, that is going to be effective or not effective as we go forward. And the last thing I want to say is, I'm definitely going to get that book that Donald recommended, but I'm also beginning to see a contribution from China. Very recently, the very well-known Wang Hui has been putting some of that narrative into the Chinese ideological political framework. So we're maybe beginning to see the beginning of a Chinese contribution to the Chinese political system, which is an outlier in the world. So going forward again, I think COVID is providing a lot of rich materials for reflection.
Alex, can I respond quickly to Christine's point, which is so important? Actually, the US federal capacity has been degraded for a very long time. I'm sure all of us remember during Hurricane Katrina, FEMA, right, the Emergency Management Authority, was completely incapable of providing the necessary things that a federal authority should do. And of course, the Trump administration, the 4 years of Trump administration, I think has degraded federal capacity even more. And I agree with Christine that, look, going ahead, even if you don't fundamentally rebalance state and federal responsibilities, it is so important that, you know, capacity at the federal level is rebuilt, is built up again, at least for the US. One thing I found very strange in the US is people tend not to trust central government or federal government, but there's a lot more, but state government, local governments are far more functioning, right? And trust in local governments tend to be higher. My sense is, and Christine, Mike, and Anthony, certainly you all know more about the Chinese system. My sense is in China is almost like the opposite, right? People always complain about corrupt local officials or inept local officials. I mean, they want to complain. Who do they go to? They don't complain to the local government. They complain to the central government. So in China's case, trust in central government, right, is much. And also look at this crisis, right? Initially, blame was put on the Wuhan officials, right? By all levels, both by society as well as by the Chinese national government. Local officials were blamed for not acting aggressively or sooner, but yet trust in the central government is very high, right? So that's an interesting contrast, I think, between US and China.
Yeah, interesting question from Xiaofan. Basically, she was saying that, you know, most governments are struggling with their own response, and then there's a lack of, you know, bilateral and multilateral cooperation. I agree with that, and especially I think international cooperation is somehow weakened by Trump administration's stance towards cooperation. So have we witnessed any good practice in terms of multinational cooperation?
Well, I think I agree. Trump's unilateralism certainly has an impact. Not just on this pandemic, but all other issues as well, just like climate change, for example. But Trump's phenomenon is not an isolated one. It's part of the emerging kind of more nationalist, nativist populism in many parts of the world, in other countries in Europe, for example. In as much as we need more international cooperation, sharing of experience, collective efforts in fighting this global pandemic. But at the same time, we see some cross-national organizations actually failing to be prominent in leading that kind of efforts. WHO was embroiled in sort of a kind of politicization. And of course, the judgment given by WHO at the beginning, in my view, has resulted in some kind of underestimation of the risk involved. For example, the issue of whether or not to wear a mask. And the politics within WHO has also made it less effective compared to SARS back in 2003. Secondly, Europe now is another kind of epicenter of COVID-19. But we can see that while different countries within Europe are trying their best to cope with the crisis, but sometimes with varying strategies, somehow I see the absence or the lack of visibility of the EU in this process. So yes, I think Xiaofan has made a very valid observation.
Yeah, I think I would say that despite what Anthony has described, which I certainly agree with, some of the areas of collaboration may not lead to immediate state action, but they're good for the longer term. We are seeing a lot of sharing of knowledge and science and so on that is being co-researched. And we see that perhaps different bits of the structure are kind of collaborating. We don't see everything yet because the media doesn't necessarily report all the things that are going on. So, for example, China and a number of other countries working with each other to kind of distribute and provide PPE. That's, I think, an under-reported piece of news. So maybe when COVID is over, we can have a good look at all the aspects that are out there. I suspect we will be able to identify, citizen self-help, whether in country or perhaps even across jurisdiction, as well as, at a higher level of what has actually happened that has helped someone else.
Several months ago, we had another policy dialogue exactly in this room, and that was also about COVID-19. And I remember Dr. James Wong was here joining Professor Cheung. And at the end of the talk, because I was the moderator as well, and we received a question in chat box asking Professor Cheung, how do you assess the impact of COVID-19 on the rise of China? And then I vividly remember Professor Cheung said, this might, like another 2009 global financial crisis, that will weaken the United States, but strengthen, accelerate the rise of China. And it has been almost more than half a year. Do you still hold that view?
Well, I still hold that view in a general sense. Actually, I think by hook or by crook, the COVID-19 pandemic will likely sort of subside by the latter part of next year. I mean, there's sort of a cycle of a virus, and hopefully by then we have got the vaccines available. Now, right now, the attention worldwide is on how to deal with COVID-19, whether by mitigation, suppression, whatever. Different countries having different mix of strategies. And their people's attention are also focused on the COVID-19 challenge of the day. But once COVID-19 has subsided, then people will look around. How do we deal with the aftermath of COVID-19? Economic revival. Now, you cannot have economic revival on a world scale without the China factor. The world is highly interdependent. So the kind of I don't know whether we should call it anti-China strategy or approach taken by Trump will not work in that kind of international efforts to revive the economy. So I'm more hopeful that by then the world over will realize the importance of international cooperation. And so we have to see how that will turn out. But I would just like to take this opportunity to follow up the point made by Christine, which I fully agree. Yes, despite the lack of more visible international cooperation at the official level, but certainly on the level of experts, scientists, knowledge transfer, or sort of international experience comparison, a lot has been done. I mean, some of us here, Donald, Christine, me, we are writing papers, books, and I can also let people know that some East Asian academics in public administration, we included, we have proposed to the American Society of Public Administration to host a webinar next month to share the East Asian experience of managing the crisis to our American counterparts. I think right now the world, at least at the non-official level, is trying to learn from East Asia.
Yeah.
Why East Asia has done much better in terms of dealing with COVID-19.
Alex, can I respond quickly to
Please.
that?
Yeah.
Yeah. So I agree with Anthony that really we need a more distributed system of, crisis management. And I think a lot of times when we look at this, the relative rise of China and America's awful performance in this pandemic, we think in very binary terms, right? This marks the terminal or collapse of U.S. capacity and ability to lead the world, and marks the inevitable rise of China. I think what the crisis, clearly China has performed, the Chinese state has performed much better in this crisis. But also what has been remarkable to me is that for most of the world, the reaction to China hasn't been positive at all. Right? So I'll share this. Right. So this is a survey done by Pew Research, a very well recognized think tank in the US. And what it shows is the trust of or evaluations of China across advanced economies. Views of China have become distinctly more unfavorable, right, across the world, not just the US, but also in the rest of East Asia, in South Korea, in Japan, in Canada, in France, Italy. So I think what is likely, we are likely to see after this crisis is not necessarily, right, China would replace the US as a global hegemon. I think what we should be trying to construct is really a far more collective and distributed sort of global system where and where small states also have more voice, right? One of the reasons I think American hegemony was broadly accepted for a large part of the post-war era, was that America was seen as more or less a benign power, and people generally had favorable views of these American ideals. And I don't think I don't think there is there will be the same acceptance simply of China replacing America as a global hegemon. I think China also needs to accept that as Christine and Anthony was saying, with respect to policy making, needs to be a lot more inclusive. So too, global policy making and reconstructing this system of global governance post-crisis has to bring in a lot more actors, and has to be a lot more equal and inclusive. So I hope that's also the message the Chinese leadership gets, that in order to lead, you need followers, you need acceptance, you need collective agreements, and I hope we can work our way towards that sort of system. I don't know whether Christine feels that leadership has to be a lot more shared and distributed as well.
Right. No, I do. And I, like you, well, perhaps we can just speak for ourselves first. What we don't want is the US and China to continue their conflict, because we see that pretty much all of us are potentially victim. But we also see that both countries have enormous capacity and capabilities, perhaps in different areas, but they do. And what we all want is, already when we're going into a very difficult time in the future of inequality, of climate change, of more infectious diseases because of climate change and so on. Well, we're going to have to actually work closer together. So how can we tune down, I think, unnecessarily provocative language and really find those areas that the people of the world would like to see great powers, including ones in Europe, to kind of really come together and solve problems.
Great, thank you. This is perfect time control, and thank you so much. Especially as the moderator, I especially want to thank the three speakers, Donald, Anthony, and Christine, for joining us, and it's truly very enlightening. I believe the audience, and including myself, we have learned a lot. So. As a moderator, could I suggest we, put a big hand and give applause to them, and either virtual or physical. So now this dialogue session is finally over. Yes, thank you so much.
Thank you.
Thank you.
Thank you.